So a 26-year-old woman comes to the emergency room due to abdominal pain and vaginal bleeding that started a few hours ago. Vital signs are 98 for temperature, 110 for heart rate, and blood pressure is 100/70. An exam shows tenderness to palpation with rebound and guarding. HCG comes back positive. Ultrasound confirms diagnosis. At what location does this disorder typically occur at? So I'll let you answer the question and then I'll explain it. Okay, so the answer is B, the ampulla. So this disorder is an ectopic pregnancy. So to orient you to the different anatomical regions, let's just do a quick recap. So this is just a crude sketch of the uterus, ovary, and the fallopian tube. So this will be the fallopian tube. This will be the fimbriae, which is at the end of the fallopian tube. This is the ovary. And then this is the endometrial cavity. So an ectopic pregnancy, well, a normal pregnancy is inserted onto the endometrial cavity inside here, but an ectopic pregnancy is anywhere if the embryo implants anywhere outside of this region. So let's look at the different places it can implant. And so, for example, most commonly it will implant in the ampulla, which is the widest region. This isn't anatomically correct, but the ampulla will be the widest region of the fallopian tube, and that's why it's the most common area for an ectopic pregnancy to implant. And then we have the isthmus, which is a little bit more distal to the ampulla, and around 12% of ectopic pregnancies will insert there. And then we have the infundibulum, which is the proximal part, and then finally we have the fimbriae, which around 5% will have an ectopic pregnancy be there. So now for the clinical picture. So if you have a female patient coming in of childbearing age with abdominal pain and vaginal bleeding, then first of all, if you have a patient come in with abdominal pain, the differential is huge. It could be anything. But then on top of that, if it's a female patient, you always have to rule out pregnancy because that's not something you want to miss. It can be easily missed because you might be thinking appendicitis or gallstones, but you always have to rule out and get a HCG just to make sure that the patient's not pregnant. And the second reason is if the patient was pregnant, that also changed what medications you can give. And so it's always important if they come into the emergency room to get an HCG. Okay, so now if it's abdominal pain plus vaginal bleeding, now this is something where you'd really start thinking about ectopic pregnancy. It's the classic case. So you get HCG, you would see it, and then you'd see that it's positive, and then you would get the ultrasound to look for the signs of an ectopic pregnancy. And in this patient specifically, she had a acute abdomen, which is a phrase to describe a surgical abdomen, which just means that you need to operate on this person immediately. So in this case, you have rigidity, and so rigidity is involuntary contraction of the abdominal muscles. So when you palpate the abdomen, it will feel very hard because the patient's involuntarily contracting all those muscles. Rebound is the fact that it's so painful that when you let go, the pain will be significantly worse. And a clinical tip, if someone's in that much pain, you typically don't want to do the abdominal exam the way they ask you to do it, which is tell me if it hurts when I push and then tell me if it hurts more when I release, because the patient's in so much pain, it'll be pain regardless. So if they're exquisitely tender, you can actually use percussion, and it's been shown just lightly percuss that area, and that's equivalent to getting a positive rebound sign. And so another thing to look for is for ectopic pregnancy is the serum HCG. And so normally it doubles every 48 to 72 hours. However, in an ectopic pregnancy, it actually doesn't increase. And so that's another sign. You'll also have to ask for their last menstrual period and see how far off they were. And then that can kind of tell you if their HCG is in the right spectrum, is in the right ballpark where it needs to be, and that can also clue you in. And the final thing is the ultrasound can really clue you into that. And so the treatment for this is laparoscopy if the patient is stable. But if the patient's not stable, you have to do a laparotomy, which is more invasive. This just is hemodynamically unstable. And so that's ectopic pregnancy. And so let's go back to the question and see what we needed to answer this. So first off, we had to realize that this is a patient with abdominal pain and vaginal bleeding, and it's a woman of childbearing age. So we immediately need to have ectopic pregnancy at the front of our differential. Next, we have to look if it's stable or unstable. And so in this case, it's unstable, right? Because you have low blood pressure and a high heart rate. She doesn't have a fever, which is good, but still unstable. It meets SIRS criteria, which you'll learn about through your clinical rotations. And then this is also another indicator. HCG is positive, and then ultrasound confirms the diagnosis. So what's interesting about this question is even though you discovered the diagnosis correctly after seeing the pattern recognition of abdominal pain and vaginal bleeding, and then these two things further solidify your diagnosis that it's ectopic pregnancy. That actually isn't what the question was asking. The question needs you to have that as a baseline. You have to understand that that's the diagnosis, and then ask a second order, which is where does this location that this disorder typically occurs, and that'll be the ampulla. So you essentially needed to have the pattern recognition to recognize that what the disorder was, which in this case was ectopic pregnancy. And the second thing is to know one more fact about ectopic pregnancies, which is the most common location, which is the ampulla, because it is the widest part of the fallopian tube. So that's why it's just logically, because it's the widest, it's the most common place to have this implanted. And so I hope that helped, and thanks for watching.